Pulmonary aspiration during anaesthesia is rare, but when it happens, the consequences can be severe. At Our Lady of Lourdes Hospital, we reviewed our pre-operative fasting practices to see if we could reduce unnecessary fasting without increasing patient risk.
Why is pulmonary aspiration still such a concern in anaesthesia?
It's rare but potentially fatal. In fact, NAP4 found it caused over half of anaesthesia-related airway deaths and significant ICU morbidity.
How is risk usually reduced?
Through fasting. Internationally, there's a consensus that 6 hours for solids and 2 hours for clear fluids reduce the risk, but in practice, patients often fast much longer due to scheduling delays.
What are the problems with prolonged fasting?
It may delay gastric emptying, cause thirst, nausea, anxiety and discomfort. The 2-hour rule for fluid is based on limited evidence.
Why try a sip till send policy?
Water empties from the stomach within 10 to 20 minutes in healthy patients. Allowing sips until transfer to theatre could reduce unnecessary fasting without raising aspiration risk. Recently, the European Society of Anaesthesiology have recommended the reduction of paediatric fasting times for fluids from 2 hours to 1 hour prior to anaesthesia. In Scotland, a sip till send policy for elective surgical patients has recently been implemented in NHS Tayside with much success.
Who might still need the traditional 2-hour rule?
Patients with symptomatic GORD, a BMI of over 40, delayed gastric emptying, GI obstruction or severe cognitive impairment.
What did your audit show?
On average, patients were fasting for 16.8 hours for food and 9.8 hours for fluids. After introduction of the policy change, we found both fasting times were reduced, with 15.5 hours on average for food and 7.7 hours for fluids. Adherence was low, only 6 out of 35 patients followed the new approach.
How was the policy update received by staff?
Overall, positively by both staff and patients. Consequently, the hospital policy was updated on QPulse to include sip till send.
How will uptake be improved and what are your future plans?
Through education, theatre coordinator engagement, ward champions and visual prompts with a re-audit and official launch date planned. In summary, sip till send is a simple evidence-based change that could improve patient comfort and hydration without increasing aspiration risk. Our challenge now is not the science, it's making sure everyone follows it.